Ventricular septal defect, an animation to exemplify the abnormal blood flow and its treatment. Anatomy of heart and septum. This is a cross-sectional view of the heart. The septum divides the heart into left and right. Blue color represents oxygen-depleted blood in the right side of the heart. Red color represents oxygen-enriched blood in the left side. This slide shows us the normal flow pattern of blood from one chamber to another. The flow of blood is unidirectional and valves between the chambers prevent backflow. This illustration shows us the hole present in the ventricular septum. Since the pressure in the left ventricle is more than the pressure in the right ventricle, oxygen-rich blood flows from left to the right side. Mixing of oxygen-rich blood with oxygen-depleted blood is shown in purple color. During open heart surgery, a synthetic material called Gore-Tex or Dacron is used to close the defect. Moderate to large size defects or multiple VSDs can be closed by surgery. Here we can see the normal flow of blood is returned after surgery. If you have recently undergone this surgery, you're encouraged for a regular follow-up with your cardiologist.